So welcome and thank you for joining us at this very important webinar. I'm Monica Ferry, the Chief Executive of the Genetic Support Network of Victoria, and I'm delighted to be partnering with Women with Disabilities Victoria to highlight and engage in a discussion about a critical community crisis. The past few months have provided many challenges all at once. Like no other time since World War II have we faced the uncertainty of the present and the confusion about the future that COVID-19 has delivered. We've had to dig deep to remain hopeful and place our trust in others to do the right thing, consciously placing our individual and personal needs behind those of the community as a whole. People with genetic, undiagnosed and rare conditions, people with disabilities, can face this uncertainty every day of their lives, and they can be encouraged to fit in, to trust in a world that often doesn't support them. Today we will focus on family violence as an area that devastatingly touches many of our community. We will hear some heartbreaking statistics and be asked to find our place as a passive or active influence. Our own self-awareness is the pathway to change. We will also explore our role in prevention and response, and importantly, the resources that are available to us for referral and support. You'll also meet a diverse panel who will bring their experience and perspective to an active discussion. So just some housekeeping before we begin. Please keep your microphones on mute and your cameras off. Questions may be asked at any time during the webinar. Please put them into the chat function and they'll be answered through the discussion or at the end. The webinar will be recorded and the transcript made available with the video. We will also include any unanswered questions on the GSNV Facebook site, so we'll know that at the end. A link to a feedback form will also be posted during the chat at the end of our session, so please, we'd encourage you to take a moment to complete that. I'd also like to just remind you or to let you know that the GSNV will be hosting a Wellness Week in November as a follow-up to this event for our genetic, undiagnosed and rare disease communities, and it will include a full day's training on the right to safety delivered by Women with Disabilities Victoria. I'll touch on those again at the end of the seminar, and I'd now like to hand over to Olivia and Tess from Women with Disabilities Victoria to begin. Thank you.
Thank you, Monica. I just wanted to check before we get started that all the Auslan interpreters are visible on the screen. I can definitely see one. And 2 and 3 maybe, or is the screen too small? Is that what's happening?
So I'm present. I believe we have a second interpreter that was supposed to arrive, but he may be late, but that's okay. I can kind of proceed for now if everyone's happy.
Okay.
Proceed.
Wonderful. Thank you. If anybody has any issues relating to accessibility, feel free to pop them into the chat. Matthew's just arrived, so Carrie, if you could allow his video as well. Yeah, pop it in the chat and we'll try and make sure that everybody's visible and everybody's able to see and hear what's happening. All right, we'll get started anyway. So thank you everyone for coming today. My name's Olivia. I'm a prevention training coordinator in the Gender and Disability Workforce Development team at Women with Disabilities Victoria. I've got a background in family violence response and international development with a women's health focus. And I would like to recognise my privilege up the front. I'm not a woman who identifies as having a disability, but I'm very privileged to work with many amazing women with disabilities within our organisation. And I'm going to be co-facilitating today with Tess. So Tess, do you want to introduce yourself?
Yeah, sure. Hi, thanks, Olivia. My name is Tess, and I work with Olivia in the Workforce and Development team as a co-facilitator and trainer. I have a social work background, and today I'll be using my lived experience of cerebral palsy in this training.
Beautiful. So we're going to start with letting you know a little bit about our organisation and what we do. Then we're going to start looking at intersectionality and violence against women with disabilities, prevention. We're going to point to some resources, and we're also going to talk a bit briefly at the end about how to manage disclosures in a disability context. This is in no way a holistic training on how to manage disclosures or prevention. It's really just an overview of some of the really key elements of the work that we do. And we hope that it'll sort of give everybody a taste of the amazing resources and training that there is out there for you and your organisations in this area. So, Women with Disabilities Victoria. We are the peak organisation for women with disabilities in Victoria, as the name suggests. We're a not-for-profit organisation run by and for women with disabilities. There are only a small handful of women without disabilities within our organisation. And our goals are to empower women, influence policy, and influence services. So we're not actually a service provider ourselves. What we do is more systemic advocacy, so working within the systems to make services more available and more effective for women with disabilities. Why? Oh,
sorry, Olivia. Go on.
That's all right. Why are we here today? So women with disabilities experience at least twice the amount of violence as women without disabilities. Gender-based and disability-based discrimination intersect to increase the risk of violence for women with disabilities. Other groups such as Aboriginal and Torres Strait Islander women, multicultural communities, LGBTQI+ identifying people, and older Australians may also experience violence in different ways, including additional barriers to accessing support. But most importantly, violence and discrimination are preventable. So for everybody who is tuning in today that is working in a disability context or with women with disabilities, I'm sure that you're probably aware on some level of the prevalence of violence against women with disabilities. Unfortunately, in this work, we all know women with disabilities who have experienced violence. And the reason we're here today and what we do at WDV is really geared towards preventing that violence before it happens.
So this topic might be a little distressing for some people. So I'd just like to provide a content warning before we get into the good stuff. So if you're feeling uneasy and distressed, maybe take some time out. Please feel free to engage in self-care strategies. You know, you might want to get up and have a bit of a stretch or something, and really take care of yourself, because we know these things can creep up from time to time. And Olivia and I will also be available during the session in the chat, or also to debrief if needed. And just again, as we'll be discussing violence today, may be advisable to use headphones, because some of the stuff we'll be discussing will be distressing. And if you live with anyone in your home that you don't want to hear things about violence, then it might be a good idea to use headphones.
Just a brief note as well on the language that you're going to hear throughout the session today. So we take a gendered approach to all of the work that we do. And you will notice today that when we are speaking about victim survivors, we will use she and her. And when we are speaking about perpetrators, we will generally be referring to men. This is not to say that men don't experience violence and women don't perpetrate violence, nor is it attempted to diminish the experience of non-binary or third gender people. We know that violence happens and is perpetrated by everybody against everybody in different contexts. However, the language that we chose is really meant to highlight the the increased likelihood and the statistical evidence that shows that most severe interpersonal violence is perpetrated by men against women. So we're talking about intimate partner violence and family violence. So just to be very clear, that's why we chose the language that we chose. It is purposeful and not attempted to diminish the experiences of others who have also experienced violence. So now just going to start with a brief overview of violence against women and why this is such an important issue to be talking about today. So violence against women is defined as any act of gender-based violence that results in or is likely to result in physical, sexual, or psychological harm or suffering to women, including threats of such acts, coercion or arbitrary deprivation of liberty, whether occurring in public or in private life. So this includes things like intimate partner violence and family violence, as I just mentioned, sexual assault, sexual harassment, dowry-related violence, female genital cutting, and other cultural practices like child marriage and polygamy, and forced sex work and trafficking. It's also important to note from a disability perspective that in Victorian legislation, intimate partner violence or family violence can be perpetrated by a long-term carer who may class as a family member depending on the length of the relationship. So that's an important thing to note when we're thinking about the disability context.
So some people you might hear, oh, what about men and all this kind of language that we hear out there, and the reality is that all violence is horrible, but there are some differences between violence experienced by men and violence experienced by women. And family violence is heavily gendered, as Olivia spoke about in the language component. But for a male, the location is generally in a public place, and the relationship to the perpetrator is often a stranger, and it's often a one-off occurrence, like a coward punch or something like that at the MCG when you go to a Collingwood-Carlton football match, and then that's a bit of rivalry there, just for an example. But with women, it's often in the privacy of our own home, by someone we know and trust and love sometimes. And it's often a repeated pattern, and it's more intense and more likely to be by multiple perpetrators for women with disabilities as well, and over a longer period of time for women with disabilities.
Can I just check in with the interpreters and the people that are using the interpreters yet? Is everybody seeing what they need to see? Yes, great. Great, just making sure.
In terms of rates of violence for women with disabilities are assaulted, raped and abused at least twice or 2 times greater than women without disabilities. We are more likely to experience physical, psychological and sexual violence in our homes, communities, schools, public and private institutions such as custodial, residential and healthcare. Over 1/3 of women with disabilities experience intimate partner or family violence. More than 70% of women with disabilities have experienced a violent sexual encounter, and about 90% of women with intellectual disability are understood to experience sexual abuse, 68% before they reach adulthood. So these statistics are pretty stark and dark. Nature of violence against women with disabilities. Women with disabilities are often experienced violence over a longer period of time and inflicted by multiple perpetrators. we experience the same kinds of violence as other women, but we also experience disability-based violence and other specific to the nature of our disability, including denial of mobility aids or communication devices. And this might look like a perpetrator taking a wheel off someone's wheelchair, or threats of institutionalisation, withholding food, water or medication, rough handling by care workers, and threats to withdraw care services. And we are less likely to report incidents of violence to the police and less likely to seek support than other women with disabilities. And this is due to fear of not being believed as one of the main reasons for not reporting.
So that's just a very brief overview of the experience of violence for women with disabilities as a generalised group. But as we said up the front, violence against women is preventable, and that's part of what we're here to talk about today, and it's a very large part of the work that we do in the Gender and Disability team at WDV. So this image that you can see on the screen here, the top half, the blue part of the gender drivers of violence against women, this is taken from the Our Watch Change the Story framework, which is the Our Watch is the national violence prevention organisation. And they have this amazing framework, which is available in as a document and also as a video, which we use in our more extended training. And I strongly recommend everybody checking out when you have the chance. And it really explains these 4 gender drivers of violence against women and how they interact and create a society where violence against women is so prolific. So I'm going to talk through the gender drivers very briefly. And then Tess is going to talk through the purple section underneath, which is disability lens on top of the gender drivers. So thinking about how the intersection of disability and gender increases the risk of violence for women with disabilities. But starting off with condoning of violence against women. So this refers to the ways in which we as a society respond to violence against women when it occurs, or when we're aware of the possibility of it occurring, or the way that we talk about it. So condoning of violence against women is things like justifying violence or downplaying or trivializing violence. So it might be, you know, hearing of an incident of violence and then saying, I'm sure that it wasn't that big of a deal, or I'm sure she was just exaggerating, or I'm sure that it was, you know, probably went both ways, something like that. It's also excusing the behaviour, so maybe shifting the blame from the perpetrator to the victim. You know, she can be really difficult sometimes. That kind of language and that kind of approach all falls under the banner of condoning violence against women, and that's a really serious problem that we as a society have to deal with if we're going to be able to prevent violence from occurring. Then we've got men's control of decision making and limits to women's independence. So we might view this as the sort of inequalities that often happen within relationships between men and women, where because of, you know, the way that we've been raised and the way our society is structured, men have more power. They might be making more money. You know, if women are required to take maternity leave when they have children, their careers are going to be set back as a result of that. And what we might see as a follow-on effect is a relationship where the man has more money, he therefore has more power, and he has more control over the decisions that his partner makes. And that is not only an issue for causing the violence itself, it's also a really significant barrier to a woman leaving a violent relationship, because if she doesn't have financial independence, it's going to be very difficult for her to make those decisions. Stereotype constructions of masculinity and femininity. I'm sure it's not too hard to imagine what this might mean. So thinking about stereotype constructions of men as having to be very strong, very stoic, very assertive and in control of the situation. And then stereotype constructions of the femininity that women should perform. So being submissive, maybe being, looking after the house, performing all these domestic roles, cooking, cleaning, mothering. Maybe it would be about the way women look as well. So, beauty standards and things like that. And when those constructions of masculinity and femininity come together in an interpersonal relationship, we see inequalities and we see performances where men are going to feel like the need to assert more control, and women are going to feel powerless in that situation because of the way that they've been prescribed to behave throughout their lives as women. And finally, we've got disrespect towards women and male peer relations that emphasize aggression. Of course, disrespect towards women can come in so many forms. It could be the language that we use, the jokes we make. It could be seen in the media, in advertising, sexualization and objectification of women. It could be in pop culture in the form of songs, things like, rap music that can be quite offensive to women, or really all kinds of music that can be offensive towards women. This kind of just creates a societal view of women where they are of less value to men. And then male peer relations that emphasize aggression. So this is the idea that as young men are growing up, they are not encouraged to express their emotions in a constructive way. Often they are discouraged from doing that, and in fact told that violence is an acceptable way for them to resolve interpersonal disputes or to express their emotions. And that really leads to a situation where those young boys become adult men, and that's the only tools that they have at their disposal to express themselves. So that was a lot of talking at you by me, so I'm going to pass over to Tess now to apply a disability lens to these drivers, and have a think about, as she's speaking, how this might relate to the women that you work with in your services or women with disabilities that you know.
Yep, so thanks, Olivia. So just when it comes to condoning violence against women with disabilities, as I said before, we experience the same kinds of violence as women without disabilities, but we might experience something like justifying the violence, like when someone says, he does so much of her caring needs, and he provides support for her. No wonder why he's so stressed. He has to come home from work and then deal with her caring needs. No wonder why he hit her, or something like that, to really condone violence against women. As an example. And also when it comes to the second one, so able-bodied control of decision making and limits to women's independence for women with disabilities. I'd like to give one example. I love this example actually, of financial control, where possibly you're in a situation where, let's say, a woman with a disability and her parents are talking about her having more financial control, and the woman really wants to have more financial control so she can develop her independence and maybe go on a date with her boyfriend to the movies. Because parents and carers are very protectionist, and possibly think that, she's not able to do this. Well, this is because we've never been given the opportunity or the chance to take risks. And I don't know about you, but if, I was given pocket money as a child to manage my own budget, but if you can imagine, if you're given pocket money as a woman with a disability for the first time at 40 years old, you can imagine then that, you're going to make mistakes at the start, and it's called dignity of risk. So this ability to take risks and learn from them. Women with disabilities don't often get that, and this protectionist vibe, although well intended, can sometimes really hinder our basic human rights and lead to violence. So you just got to be really careful of that. And I also like to highlight, Olivia mentioned in this one, barriers to leaving a relationship. I would also like to mention that if a woman with a disability has access to things like finances, transport and communication, then they are more likely to leave a relationship safer. But if they don't have those three things accessible to them, it is harder for us to leave. And when it comes to stereotype constructions of masculinity and femininity, well, in relation to women with disabilities, a lot of women with disabilities are infantilized or treated like a child. We're not seen as sexual beings or wanting to have sex at all. And when it comes to sex, we're often not told to get into meaningful, respectful relationships. And if we do get into relationships, we are told that we should be lucky and grateful for the relationship that we get into, even if that is violent. So you can see here how these kind of stereotypes play out, and you know, yeah. And when it comes to disrespect towards women with disabilities and male-peer relations that emphasise aggression, well, I always like to think of the example that, you know, I would never date someone in a wheelchair, or this, you know, over-fetishisation of women with disabilities that, you know, or this idea that we'll behave in passive ways if you have sex with us or sleep with us, which is really a model of disrespect. Yeah. Even like the small little microaggressions that we get on a day-to-day basis. Like, I remember one day wheeling to work, and someone said how inspirational I was just for getting up and living my everyday life. And I turned around and I said, "Excuse me? Do you realise what you said?" And I sassed her into, you know, educated her with a little bit of sass. You know, yeah, you know it. Anyway, I'd like to pass it back to Olivia because I think I covered those really well.
Thank you, Tess. Beautiful. All right, so we just wanted to make mention of the dynamics of power and control in a relationship where abuse is present, particularly for the context of workers in the disability and health services sectors. So abuse within a relationship occurs when one person chooses to exert power and control over the other person. So as we mentioned earlier, you know, gender inequality is a key driver of violence in a heterosexual relationship because men have more power than women. And when there is abuse, that is men choosing to assert that power over women in a violent way. Where there is already an imbalance within a relationship, abuse is more likely to occur. Power imbalances can also occur in other kinds of relationships, such as between a person with a disability and a carer, or between a health professional and a patient. Both parties in this situation should be aware of the power dynamic within the relationship and work together to ensure a mutual understanding and equal share of power. So this is really just to say that sometimes abuse is always a choice, but in the context of violence against people with disabilities, sometimes it can begin in a place of concern or care. So you could have a situation where maybe a parent of a child with disability was really, you know, had the best interests of their child at heart, and maybe that leads to them not allowing them access to their own money or not allowing them the freedom to travel, for example. And though that does come from a place of concern, it is still depriving somebody of their freedom and their rights, and that does still constitute abuse. And similarly, within a professional relationship between a client and a professional, sometimes these small power imbalances can start to creep in and inform the dynamic of the relationship. So we just have to be really careful as professionals that we're really aware of that at all times, and that we make sure to take action in everything that we do to equalise that imbalance.
So, reinforcing factors are factors within the context of a gender driver that can increase the frequency or severity or the impact of the violence. So you might hear things like, "Oh, he was drunk. No wonder why, he hit her, or he's on drugs, and this impacted on his ability to think straight. So he was violent." What we know is that not everyone who uses alcohol and drugs are violent, but if you're already a perpetrator or an abuser, then these factors are going to increase the likelihood and severity of violence against women. So when it comes to disability-based violence, reinforcing factors against women with disabilities, like condoning of violence against people with disabilities in general, restrictive practices. This might look like, as I said before, taking a wheel off a wheelchair. It might look like something like chemical restraint, like overdosing us to make us more drowsy, for example. Lack of decision-making, choice and control. Financial control, like the example I gave before. Limits to independence rights and liberties. Repeated exposure to disability-based discrimination and violence, like those microaggressions or little unkindnesses that I talked about before, that really build up over time and can lead to some violence.
Thanks, Tess. So now we just wanted to, before we move into managing disclosures, we just wanted to point to some of the resources that are available for professionals around the prevention of violence against women with disabilities. And these are resources that WDV have developed and that we as trainers find really, really useful in our work. So first of all, there is a suite of 4 videos that WDV developed with the NDS, and these are an introductory video, a video on primary prevention, one on tertiary prevention or early intervention, and one on response to violence against women with disabilities. And these are all targeted at the disability workforce, and they give really tangible examples of what is and isn't appropriate behaviour in each situation, and how you as workers might step in early on in a situation and create change down the line that is going to prevent violence against women with disabilities who are your clients. So I can't recommend those enough. We use them in our training. They're really fantastic, and they're available on the WDV website and on the NDS website. We'll send you out a link to those videos in a follow-up email for this session. And there's also documents that come along with each of those videos that you can use as a training tool if you did want to display that to your staff members. And it's got some background information and statistics and that kind of thing as well. So really useful there. We also have a document that is family violence response for the disability workforce, specifically in the COVID context. Obviously, as we all know, everything's upside down at the moment. And among many other things, there is an increased risk of violence against all women, and specifically women with disabilities, as a result of the lockdowns, the virus itself, and also the rhetoric that has surrounded the way that politicians and the community has approached the pandemic. So that's a really useful resource for workers as well. And we've also got launching this week, I believe, a workbook that is an organisational change approach. It's called Working Towards Being a Gender and Disability Equitable Organisation. And it's got sort of 10 areas in which your organisation might work towards being more gender and disability equitable. And it's got steps on how you might do that. It's got places to sort of track your progress. Generally just a really fantastic resource if you're looking for a more holistic approach to this work within your organisation. And alongside these, we also have a fantastic resource that was developed by WDV, I think over a year ago now, which is called the Our Right to Safety and Respect. So now I'm going to hand over to our colleague Carly, who's going to talk a little bit about that resource and show you a little snippet of the resource itself.
Thanks, Olivia, for that, and welcome everyone. So the Safeguards project aimed to increase women with disabilities access to safe, useful and good practice information about their right to safety and respect that builds their confidence and knowledge and actions to identify and seek support if they experience violence and abuse. This project was supported by the Victorian government, and it did start up a few years ago by the delivery of a few resources, so which we call our suite of Our Right to Safety and Respect resources. The first one was around the guidelines for developing resources with women with disabilities about safety from violence and abuse, and this is a resource that's aimed at organisations in engaging with women with disabilities on developing key resources around around what's appropriate for women with disabilities and what is in best practice of how to promote and actually utilise those resources. From that, we use that guide to inform how we produce our key resource, which is the Our Right to Safety and Respect, a video resource and video guide developed by and for women with disabilities about violence, abuse, safety and respect. I know, it's a very, very long title, that is. So with this resource, it's got a video and a video guide, so they come as one resource. And in the 20-minute video, women with disabilities speak about their own personal experience of violence and abuse. The women talk about how they found ways to speak up, which is key, and be heard and get support to live free from violence and abuse. Other women who work in different services are leaders and advocates in the community, talk about women's rights to respect violence and abuse and how to get help. And the video guide, it provides additional information and specific questions are asked to support women with disabilities to think and talk about violence and abuse and know more about their rights to safety and respect. The guide also gives phone numbers and links to services and organisations that can support women to feel safe. So from that, we've developed it into plain English and easy English with the wonderful funding from the Victorian government. And then early last year, we received a generous grant from the Victorian Women's Trust community grant to produce the resources in formats that are accessible to women who are vision impaired, blind or deaf blind. So we were able to produce the resources with the help of Vision Australia. So now the video guide comes in Braille, in hard copy in grade 1 and grade 2. It also is available as electronic BRF file, which is a Braille ready file, in both grade 1 and grade 2. We also have the book as an audible MP3 file as well. And for the video itself, we have that audio described. So the video itself comes already with Auslan and closed captioning, but adding on these additional features to it makes it more accessible to a wider cohort of women with disabilities who are at risk in our community. So these resources are available to download from our website, and they're also available in hard copy upon request. This has been a very, very popular project, and even though it's a Victorian-based project, there has been a lot of reach for it interstate as well. So I'm going to introduce the trailer of our video so you can get an idea of what the resource is about. Thank you, Olivia.
Our right to safety and respect. I think it's really important for all of us to find someone that we can trust, and to know that violence is never okay. We don't have to put up with it. It's not the fault of someone who experiences violence, it's the fault of someone who's perpetrating.
I didn't feel safe at all. I was trying to get help the best way I could, and nobody was listening to me.
It's important to listen to women with disabilities because we have good ideas about our right to be safe, not just rights in relation to their disability, but also women's rights. Safety and the right to be safe is not just about not being hurt, it's also about health and proper care.
So the program is a women's program for women with disabilities. It's a program to empower and enable the women to learn to gain confidence as well as to make friends, to be involved with their community, to learn to make change and to lobby for change. They are a group of women who are at risk within the community.
I came to the conclusion in those early days that it wasn't my shame to carry. So to put that back on him, and actually Women with Disabilities taught me about human rights, and that was so huge. If I'd have known my human rights back then, I would have immediately recognised when they were being violated.
I started feeling much stress. My health started to get a lot better. I was not pressured into things that I didn't want to do. You know, ever since then I started getting stronger, powerful. I started finding out things about my Aboriginal side of the family as well. And that's why we need to get it all out there for those women who are going through the domestic violence now, to do something about it if they want to feel free as a bird, like me.
What we know is that women feel stronger by sharing their story, by being respected and being believed, being listened to, and going somewhere else if the first person you tell doesn't hear you and doesn't believe you. Because of course we all have a right to be believed. We're the experts of our own story and our own experience.
Women with Disabilities Victoria, empowering women.
Thank you so much, Carly. I hope everybody, hope that was clear and audible for everybody, and that that you enjoyed that. So there is, of course, all the resources that Carly described available, including the video at its full length. So anyone can always feel free to get in contact with WDV if you'd like to have access to those resources. And as well, just before we jump into managing disclosures, we also are running a calendar training over the next few weeks. So if there is anybody who is really interested in this primary prevention of violence against women with disabilities, Monica's going to talk about some other opportunities at the end of the session, but just to mention that as well. So you can get in touch with me or WDB if that's something that interests you. So now we're going to come to managing disclosures in a prevention context and a disability context. I mentioned at the start, but just to reiterate, this is a very, very brief look at managing disclosures, and we don't want to give anybody the impression that after this short session that you are fully equipped to responding to violence against women with disabilities. This is really just an overview, and hopefully will point you in the right direction for accessing further resources and training if that's something that you think will benefit yourself or your organisation. But in our work, there is the possibility that we may have disclosures of violence made to us by clients, including women with disabilities. We've talked about the prevalence of violence against women with disabilities, so we know that this is a reality. And managing these disclosures in a safe, supportive, and culturally sensitive way is key to a woman accessing appropriate support and overall in breaking the cycle of violence, particularly for women with disabilities. You need to be aware of your organisational policies in relation to managing disclosures. So if you work in a client-facing role, there will be an organisational policy around this, and it's important to be across that. And if you think there is risk to a child in a violent situation, you'll need to follow safeguarding protocols. So we're not going to go into that today, but that's something that all service providers should be aware of. And if you're not aware of it, you should speak to your manager or contact a specialist family violence service to get more information around safeguarding. Remember that in any situation where violence is being disclosed, your priority as the person who's receiving the disclosure is your safety and the safety of the woman. So to make sure that that is always at the forefront of your mind, remember that if it's an emergency situation, call 000. Under any circumstances, if you think there is a risk to somebody's safety, always call 000. So when you do receive a disclosure from a woman with disability or a client, it could come in a face-to-face situation, it could come over the phone or via email. It could be something that's happening at present, or it could be historical, and they could be asking for your support, or they could just be, looking for somebody to talk to. So there's many, many variables that will inform how you should respond, but we've pulled out sort of 4 key elements to managing a disclosure that I think if you have these 4 things in mind, you're going to feel a little bit more confident and able to handle the situation more effectively. So the first thing is always believe. I can't stress this enough. It's never your responsibility to question the story of a woman with a disability or suggest that she might be lying. You are not the judge and jury. You're not a police officer. Your role is to support that person. And we know statistically that most women who, most doesn't even really express it thoroughly enough, nearly all women who disclose violence are telling the truth. And more often than not, women who experience violence won't even disclose it for fear of not being believed. And this is particularly pertinent for women with disabilities. So you always believe in, that is our role as people who are providing services to women with disabilities. The second important thing is to validate somebody's experience before you start offering suggestions for how to help. So validating somebody's experience could be just saying something like, that sounds really horrible. I'm really sorry that this has happened to you. Or that sounds like it would have been really challenging. You've done a really good job managing this situation up till now, and I'm glad you've told me. So centering the woman's experience is really important before you start thinking of the actions that you might take from that point. It really shows that you are present and that you are there for the person themselves, and that you are not just trying to move forward with your day. And this is just another part of that. It really just shows that you respect the significance of what they've told you. And it's particularly important because you might be the first person that this person has disclosed to, and having a really positive first experience of disclosure is going to be very significant for that person's journey to freeing themselves of that violence. The third thing is anti-violence key messages. So there are some key points, and that I think that as a society sometimes we fail on when it comes to managing disclosures of violence. And it's really important that you nail these particular things and get them right the first time, so that again, the person who's disclosing is going to have a more positive forward experience in terms of accessing support. So anti-violence key messages are things like making sure that the survivor knows that it's not their fault. So if somebody comes to you and says, you know, my partner has been abusive towards me, things that you don't say are, oh, but he's such a nice guy, or, oh, I'm sure that there was a reason for that. So those kinds of responses are shifting blame from the perpetrator onto the survivor, and that is something that it's really important not to do. Other key anti-violence messages are that violence is illegal, and it is a big deal. So if the victim survivor sort of is tending towards downplaying the abuse, you safely and respectfully can say, actually, no, violence is never acceptable. It's a choice and it is against the law. And, you know, there are many other key messages, but we, in some of the resources that I pointed to before, we've got those listed out a bit in a more specific way. But generally speaking, violence is against the law. It's never acceptable and it's not your fault. Those are the important things to reiterate. Something that it's important not to do as well is sort of ask why the survivor has or hasn't taken action until now. So why didn't you call the police? What did you do to cause this violence? Those kinds of questions, because again, that's shifting the blame. That's not what we as supportive people and workers are intending to do. And then the fourth key area is, of course, referring to a specialist service, because the majority of us here, we're not specialist family violence workers. So you might be the first point of contact and you might be the first person that the survivor has disclosed to. And if you handle that situation effectively, that can be really important for their journey. But often that will be where you hand that person in that situation over to a specialist service who will know about the legal remedies, about accessing a refuge, about accessing outreach services. So we're never asking you to be an expert if you are not a family violence expert, but it's important that you know what services are available so that you can safely support your client to access those.
So I'm just going to briefly talk about referral services, and the external referral guide you have received contains a list of common referral services and what support they offer. Some important services to note are, in general, 1-800-RESPECT is a national domestic violence counselling service. Safe Steps is a Victorian service, so it has no knowledge of state legislation and supporters. So it has knowledge, not no knowledge. Sorry. Wire can provide information and referral. It's a referral service. In Touch is a multicultural centre for family violence. Aboriginal family violence prevention and legal service. Switchboard, which is the LGBTIQA+ support service. And for women with disabilities, there's Daru. And this can offer local or relevant advocacy organisations and offer support there. And then the Disability Services Commissioner for complaints against the service provider. So yeah, just some very basic referral services you can have at hand.
And as I mentioned earlier, we will provide a full list of these services and some more disability-specific services in your follow-up email to this session.
Yeah, thanks, Olivia. And just a note on vicarious trauma. So vicarious trauma occurs when a worker or support person is exposed to disclosures of trauma from others, or kind of like a secondary trauma after working for a long time. And it can build up over time or occur as a one-off incident. It can have significant impacts, and some of the signs and symptoms of vicarious trauma might include repetitive thoughts about the disclosure, frustration, fear, anxiety, irritability or trouble sleeping, a sense of loneliness or isolation, particularly in this COVID context we're living in now, feelings of helplessness, anger or frustration, or burnout or lack of motivation, you know, struggling to lift your feet at the beginning of the day or something like that. And it's important to monitor yourself and to exercise self-care in your work, you know, whether you do meditation or whether you call a friend or something like that is really important to do. And remember that services such as 1-800 Respect and Safe Steps are on offer to debrief and to provide counselling to third-party workers such as yourself, or you can contact your EAP. And just a last little bit on self-care, which can also mean taking a break when you need it, or doing something you enjoy and that relaxes you, or sharing your load with those around you. I know it's really important to like bounce off each other. At WDB we provide lots of collegial support, so that's a good example. And now I'd like to introduce Scott from the Brotherhood of St. Lawrence to introduce the panel discussion. Thank you, Scott.
Thank you so much, Tess. It's lovely to be here. Before I say a bit more about myself and this last session, we're just aware that we didn't acknowledge the First Peoples of our nation at the very beginning of our webinar today. So I'd like to take this opportunity to do that, to acknowledge the First Peoples of all the different lands on which we are coming from today, because we're a virtual world and we're standing on many different pieces of land around our country. So to acknowledge all the First Peoples and to pay respects to elders past, present and emerging, and to acknowledge that we live in a time when we are looking forward to real reconciliation in our country, where we can all work together and walk together as one. So my name is Scott Holmes. I've been working in different ways in the prevention of violence against women sector for nearly 10 years now. 4 years of those were at our Watch, who Olivia mentioned earlier, who are the people that helped write the Change the Story framework. And up until the last year I was there. I was currently still involved in prevention, particularly in the faith setting. So I'm involved in a number of projects on reference committees and committees of management for prevention work that's happening within the faith setting, both locally here in Melbourne and nationally as well. And in my role at the Brotherhood of St. Lawrence, I'm involved in some prevention work also. So this last part of our webinar today is going to be a Q&A, where we particularly want to start to explore some of the issues involved for professionals in the disability sector in their work, and how they can keep that gender lens front of their minds in the way that they do their work, in the way that they work with clients. And to help us do that, we're going to hear from 3 people with lived experience, both of disability and of violence. And they are Heather and Nicole and Jane, and it's great to have you all here. And I'll introduce each of them in a bit more detail in just a moment. And then there'll be a time at the end for questions from the audience as well. And we invite you to put those in the chat box. And I'm going to do my best to keep an eye on that as we go through, and hopefully be able to field some of those questions at the end after we've heard from Heather and Nicole and Jane. And Scott, can you take a photo? Can we take a photo? I'm sure that Olivia can take a photo, yes. I also am privileged to not live with disability, but in my work at the Brotherhood of St. Lawrence, which is a large community care agency based here in Melbourne, I do work a lot with people who work with people with disability. So a lot of the work of the BSL agency involves working with clients with disabilities. So particularly, for instance, we have a large NDIS local area coordinator workforce, and we have other people working in the aged sector and other community sectors as well. And I guess as a bit of an introduction to this issue of how we can support professionals to keep that gender lens across their work, some of the things that I certainly notice with these people is that many of them haven't had any training in gender and violence issues. They are not necessarily recruited because of their background in that space. They're recruited for their backgrounds in other ways. And they're really crying out for more training. It's a real issue. And whenever I talk about my background in violence prevention to these disability workers, they often say, we'd love to hear more, we'd love to know more about this space. So this sort of webinar itself is the sorts of thing that unfortunately many of our disability workers don't have access to, or haven't realised that this is available. The second thing that I notice about them is that often their work is very much focused on sort of the practical outcomes, you know, getting the equipment that's needed, sourcing service providers. And it doesn't often seem as though there's time for that more contextual issues about the sorts of environments that their clients are living in, and how gender might be playing out and the gender drivers might be playing out in those environments. So there's an interesting question, I think, about how we create more space for those sorts of conversations in the work that they do, that it's not just focused on equipment and on other practical matters. And then the third thing that I'm very aware of is what Tess just touched on before about vicarious trauma. Myself and the other two chaplains who work at the BSL agency, we're staggered by the amount of vicarious trauma that a lot of our disability workers are living with, along with burnout and other things. It's not just that they're experiencing trauma from the clients, traumatic stories, but as many of you I'm sure be aware is that the disability sector itself is a traumatic sector. Legislation is constantly changing, there's new rules, there's very high expectations about throughput and so forth. So the very system itself can be quite traumatic as well. And we're very aware that, that a lot of our workers are experiencing various levels of vicarious trauma. And so then you have to ask, well, what impact does that have on their ability to actually think in more complex ways, to think about this gender issue along with all the rest of their work that they're doing? So it's a very difficult area, but as we've heard from Olivia and Tess and Carly, it's just so vital that we support our disability sector to understand the gendered nature of violence against women, and that this is a big part of the work that they are called on to do. So without further ado, let me introduce our first panellist, Heather. So Heather Renton is the Chief Executive Officer and founder of Syndromes Without a Name, SWAN. And SWAN provides information and support to families caring for a child with an undiagnosed or rare genetic condition. Heather is the mother of 2 children, one of whom has a rare genetic condition, and she's a passionate advocate for families who have children with these undiagnosed and rare genetic conditions. Heather, thanks for being with us today. Many of the concepts we've been talking about, these gender drivers, human rights and so forth, are quite complex topics to be talking about. What do you think professionals need to keep in mind when they are working with young women with disabilities to build a greater understanding of these sorts of issues, and particularly those gender drivers?
Look, I think they have to be aware that not every young adult with a disability has been given the tools to keep themselves safe. And I think, you know, that goes back to, we really need to change the system from a young age. So, you know, we should be teaching kids in schools to be respectful of everyone. We should be giving girls with disabilities, and I should say my 14-year-old daughter has an intellectual disability, we need to give them the tools so they can help them keep themselves safe and empower them from an early age to know how to keep themselves safe. And look, it is difficult for young kids because with intellectual disabilities, because it takes them so much longer to learn. And, you know, I'll just give you an example of something that happened in our house this morning. You know, my daughter knows about private, public, but no, she opens the curtains to pat the cat and she wasn't dressed yet. So it's a continual challenge. And I think professionals can, you know, just help remind young adults of who have disabilities that they need to keep themselves safe so that, you know, violence doesn't happen to them. And if they do feel vulnerable, then they need to reach out and tell someone so they can keep safe. So it's got to be a two-way partnership. You can't just leave it all the time up to the person with a disability. You've got to help them to help themselves so they can remain safe. But I also think professionals have responsibility to provide resources for people with disabilities. So, you know, there's very few resources out there, video resources, that are set in a way that young people with intellectual disabilities can understand. you know, there was a video, and I think it was set in the early 80s, called Janet's Got a Period, about, you know, not telling the bus driver that you've got your period, that type of thing. But it's very outdated now. Where's the funding to build really good resources targeted at people with intellectual disabilities? There's not enough easy English resources, there's not enough videos, there's not enough teaching going on in schools. So I think, you know, there's a lot more we can do to help women with disabilities stay safe. Even, you know, NDIS, why isn't funding given to families so children can do these courses to help them stay safe? You know, Family Planning Victoria used to run one-on-one classes, and now I think it's more group settings. Programs like Relate used to be in schools. Well, they've closed down because of the NDIS. I know many families within the Swan community aren't getting funded for opportunities to, you know, empower their young people to stay safe, speak out if they are experiencing violence. They're getting rejected from the NDIS. So there's a lot of work that we need to do, and professionals, you know, it should be a partnership. They should be helping young families to access these resources. But if we don't do something now, we're going to end up in having the same conversation in years to come. So I think, you know, we really need to start acting now. And I think professionals, doctors, advocates, educators, all have their bit to play in empowering women and giving them the tools so that they can remain safe. And I've probably got a bit off subject and question with your question, Scott, but hopefully that answered it.
That's absolutely on track. That the importance of having resources that are tailored and that are actually going to meet the needs of different people in our community. And I think it's really interesting, isn't it, how as we pour more money into the system, somehow we still fail to remember that there's very different people that need to be provided for.
Yeah.
It's not a homogenous group, that women with disabilities aren't a homogenous group. They're all sorts of different people, and that we need resources that are very much tailored for them.
Absolutely. And if you look at the mainstream school system, many mainstream schools will have an organisation come in every 2 years to talk about puberty, staying safe. But there's not the social competencies that people with intellectual disabilities need that goes on in mainstream schools all the time. You know, I think, you know, we need to really focus on educating so we can prevent crimes in years to come. And, you know, we've got to protect one of the most vulnerable population groups.
Yeah.
And I don't think we're doing well enough at it at the moment. I'm sorry, but I don't think there's a lot of work still to do.
Yep. I don't think anyone's denying that, Heather. Thank you so much, Heather. I'd like to introduce our next person, Nicole. So Nicole Lee is a fierce advocate for disability rights and the prevention of family violence. She provided evidence at the Royal Commission into Family Violence here in Victoria, and has been working as a member of the Victim Survivors Advisory Council for the past 3 years, and also appeared on You Can't Ask That in 2018. I discovered before that Nicole was also a great cat person, and Nicole, we were enjoying seeing one of the cats on your lap just a minute ago as well. That was wonderful. So thank you for being with us today. We've heard a lot about the role of inequality and power and control in violence against women, and the fact that those inequalities and that power imbalance can exist between professionals and clients as well. Can you tell us a bit about what you think we can be doing, or professionals can be doing, to be mindful about that potential for power imbalance and how they might mitigate that concern?
Well, I guess the very first step of you know, is to acknowledge that there is a power imbalance in all of your interactions with clients that you're working with. So, you know, the first step is to actually acknowledge that it exists. And then after that is always to be, you know, constantly mindful of, you know, what you're asking a participant and you know, sort of where the power imbalance lies. So it could be things like if you're talking to a participant and their carer is with them, are you posing the question to the participant, or are you posing the question to the carer sitting beside them? And constantly be mindful to always bring back to the person with the disability and not the person standing beside them. Because, you know, you know, for a lot of us who, you know, existed in the system, you know, for many, many years, you know, we're older people, and the experiences we've had in our lives is everybody speaking to the person beside us. And all of those things that Heather just said before is, how do we empower younger people coming up to know how to speak about their rights, know, you know, when to notice that, you know, things, you know, they're experiencing violence, if everybody is constantly speaking for them. And that's where that power imbalance, sort of being conscious of that all the time and talking to the person with the disability versus the carer beside them, even if the person with the disability isn't the one technically communicating with you. It's always being mindful to always be addressing them and their needs directly to them and not to the person standing beside them. Because, you know, if, you know, what has resulted for a lot of us in our past has been that we have experienced a lifetime of disempowering experiences, that lifetime of being, you know, spoken to, not, you know, indirectly via the person beside us. So that has, you know, for us growing up, and for myself as well, and I was in this position, was that I never thought that I had a voice, or that I was allowed to speak up, or that there was any space for me to speak up, or that anybody was ever going to listen. And that creates a power imbalance where the person constantly feels, you know, constantly and continuously disempowered. So, you know, it's all of those little things to addressing those power imbalances that are really, really important in all of your interactions with people, you know. And if somebody, you know, is giving you an answer, you know, don't be dismissive of what their response is. You know, actively listen to people. You know, don't dismiss their needs and wants, their fears or their frustrations. And remember, and this is another really big one, you know, when you're talking about violence, so I'm probably going really quick here, is that, you know, to always be mindful that if someone is acting, you know, aggressively towards you, that fear can very, very, very much look like aggression. And I was one of those people that probably reacted, I'm pretty sure I did, reacted quite explosively to questions sometimes because I was so afraid. So rather than saying to the person that they are being difficult, or they're difficult to work with, or this is probably, you know, behaviours of concern, is sitting back and questioning, what needs aren't being met for this person? You know, where's the power in this conversation lying, and why is this person feeling they need to, you know, be confronting towards me right now? And question your behaviour, question what's going on for this person in their lives, rather than just instantly going to the person who has, you know, has reduced power, reduced choices, and then putting all the responsibility on them for why they're acting out against these things around them. Yeah, I hope that sort of answers your question a bit there, without going on too much, Scott.
No, that's wonderful. I mean, you know, I think what you're saying, what I'm hearing really clearly, is that often women with disabilities have been already disempowered in so many ways, and that could be included by their carer. And so when a professional then comes along and unintentionally or intentionally colludes with the person who's disempowered, it makes it a doubly worse situation, doesn't it, for that woman?
It does, and also, you know, for some of us, I know another thing for myself is I revert to being passive as well. So, you know, when you're thinking of, you know, addressing power imbalances, is also having the time to spend with a person to slowly work with them to be able to speak up for themselves as well. So I know I very regularly will revert to being passive and not respond or go quiet or just accept what's going on. And that's an automatic response within myself that I know I'm working with. But, you know, sort of being aware that somebody's response is probably, you know, could be attributed to their life experiences. And for some of us, it is going to take time, and you need to go slowly with us, and you need to take that time to build that trust, that they can trust you and that they're allowed to speak and that they're allowed to have choices in these situations. Yeah.
Thanks so much, Nicole.
It's okay.
Let's move on to our third and final panellist, Jane. So Jane Rosengrove is a strong, powerful sister girl, a Yorta woman. She's had many roles advocating on behalf of women with disabilities, and has featured in many resources on domestic violence for women with disabilities Victoria. Jane is an active member of several advocacy groups and works as a consultant on a number of projects related to disability and violence. And in recognition of her contribution to the Royal Commission on Abuse, Neglect and Sexual Assault of People with Disabilities, Jane was awarded both the Victorian and the National Human Rights Award for standing up and having a voice. Congratulations, Jane. So thank you for being here today. We know that women with intersecting experiences of discrimination, so women with disabilities, Aboriginal and Torres Strait Islander women, for example, often fall through the cracks in our systems. What can professionals do to ensure that the voice of women with disabilities is heard and acted upon, particularly in relation to gendered violence and inequality?
Like, you mean like even with this COVID-19 at the moment, I know that there is a lot of domestic violence going on at the moment because of this COVID-19, that they are just staying home with their partners and they can't go to work, and there's a lot of it going on at the moment. There is. So while there's a lot of it going on, there's these organisations that if they want to go to, they can ring up the Women's with a Disability in Burke Street, or they can go to the Aboriginal, what is it called? Disability, you know what I'm trying to say, the Aboriginal one. They can go to that one too. They're going through this domestic violence at the moment. And because I've been through my domestic violence going back 7 years ago, when I was with my partner, and I left him because I put up with too much of it. When he headlocked me, slapped me across the face. I found out he had schizophrenia and all this, and ever since I've left him, I've been free as a bird, and I found out a lot more about my family, and I've got on, you know, my health's been a lot better since I've lived on my own, and that, and I've been, you know, working hard over time, you know, with the Reinforce and Amida, and talking about domestic violence and, you know, and all that.
Jane, what helped you to have a voice in this space? What gives you power to have your own voice?
Okay, what made me have a voice was I was brought up in an institution where people were talking for me because I had epileptic fits when I was a little girl. And then after that, I went with my partner and we left Store, went to Cranbourne, and I started the self-advocacy in the 1990s down at Western Port Speaking Out. But I was still not my strong woman. I was still depending on my partner and depending on the organisation a lot because I was still having my fits. But after I had the brain surgery in 2004, that's when I started going to Melbourne a lot more, depending, you know, going to Reinforce, learning more about my self-advocacy, about my speaking up, who can I go to if I need that support. And then I went through a domestic violence, so I started to, I gave him 3 chances after the brain surgery, and it was a 3rd chance that I left him. And that's when I felt that my voice was being heard, that I was being believed, and I was not being ignored. And that's when I got the help, and people helped me from Ross House, Open Place, Women's with a Disability in the organisation there. And that's when I started feeling comfortable, wanted, hearing people hearing my story. And that's when my health got a lot better.
Thanks, Jane. It really, your story really, it reinforces what Olivia said earlier in terms of, you know, disclosures, just the absolute importance of believing people, believing women when they talk about their story.
That's right. And if people do want to watch my story, it's on ABC Lateline, Jane's story, because they wanted someone who was strong, powerful, and who'd been through that rough life to get their story out there, even if they are going through a domestic violence now, you know? So, yeah, so if people want to watch it, it's ABC Lateline, Jane's story.
Fantastic. Thanks, Jane. And I'm reminded that, you know, we talk about vicarious trauma, but there's also vicarious resilience, the resilience we learn when we hear of other people's stories. And I think your story, Jane, is a great one for that vicarious resilience. So thank you for sharing that.
Thank
So
you.
that's our three panelists. We've got a bit of time now if there's any questions, and there's one question here. How to empower women with disabilities going through domestic violence when they come from backgrounds where maybe that domestic violence is not so culturally frowned upon, or maybe there's different aspects of the culture. So I guess we're talking here about situations where it might be condoned in different ways. Any of the panelists want to talk about that?
There's In Touch Multicultural Centre, which would be a good port of call to get advice from, which would be what I would recommend at that point. I don't know whether Olivia or Tess had anything else to add to that.
Yeah, I wouldn't mind just making a quick point on that. Going back to what Tess discussed before about reinforcing factors, it's important to remember that somebody's cultural background, cultural beliefs, or religious beliefs are never a justification for violence, or in fact the cause of violence. The cause of violence is still those gendered drivers violence against women is still those gendered drivers that we discussed earlier. And cultural practices, or as Scott said, maybe cultural environments where violence isn't frowned upon the same way it is in other cultures, those are reinforcing factors rather than the driving force behind the violence itself. So it's important to distinguish those things, because otherwise we might back ourselves into a corner where we're no longer approaching violence with an open mind and an intersectional lens, and that's really important.
Great, thanks Olivia. Yes, absolutely.
And it's Jane speaking. I was just thinking of, the outback in like Alice Springs and between Broome and Alice Springs and all that. When there's people of the Aboriginals going through a domestic violence there is no place that are very close for them to go and get the help that they need.
Yep, that's very true. There's a huge need for, it's a bit similar to what Heather was talking about the lack of resources for young women with intellectual disabilities. There's also a lack of physical resources in different places, aren't there?
And I'm on the Disability Network as well in Sydney.
Yep. We've got another question here about how we can better reach women, particularly in residential care or places where independence is very limited. Does any of the panelists want to, Heather or Nicole, have a thought about that one, about where it may be very difficult to get in touch with women?
Well, for those of us on the NDIS, like we have touch points with different areas, whether that's plan reviews, care coordinators, and it's around ensuring that if carers are in the room, just asking for a moment to speak to somebody on their own. And that's the difficult thing with COVID at the moment, is that has taken away a lot of those opportunities to have those conversations with people where you're safe away from somebody who might be perpetrating violence. So it's finding moments when you can get the person, sort of on their own to ask some really important sort of questions around, even just how you're feeling. But you're never okay to ask questions like that if somebody else is in the room with them, because you don't know what's going on and you could be putting somebody in danger. But I think I guess from my point of view on all of this is that we need to continuously advocate for face-to-face outreach. And whilst telehealth and all of that has been fantastic, we need for women with disabilities, we need family violence services and all services to do that in-person outreach to continue for people with disabilities, so that we can go into homes, see what's going on, and have a view of what's happening in somebody's life, even if they can't actually articulate at that point. Yep.
Thank you. All right, I don't think there's any other questions there at this stage. And we're almost at our time anyway. So I think at this stage, I will thank Heather and Nicole and Jane for being with us. It's been fantastic it's always so important and so fantastic to hear that lived experience from people. So thank you so much to the three of you for being here.
Thank you.
I'm going to hand back to Monica, who's going to wrap the session up for us. Thanks, Monica.
Thank you, Scott, and thank you so much to everyone for your active participation and engagement. It's so clear that we need systemic change and we need individual change as well, and we've explored both of those. I would really like to thank our presenters and our panel for their involvement, their honesty, their sharing, and remind everyone of the resources available. If you are feeling in need of support after this webinar, please access those resources. I also would like to acknowledge that we have been meeting on lands of many of our First Peoples, and I would like to pay my respects to their elders past, present and emerging. Any unanswered questions from our webinar this morning will be collected and answered through the GSNV Facebook page. We will be sharing that to Women with Disabilities Victoria, so you can access that there. A reminder that the webinar was recorded and the transcript will be made available. There is I'm hoping it's there, a link to a feedback form in the chat, so I'd really love it if you would take a moment to complete the feedback form, please. And just a reminder that the GSNV, Olivia's done that, great, thanks Olivia, that the GSNV will be hosting a wellness week in November, where there will be a full day's training on the right to safety for women with disabilities, delivered by Women with Disabilities Victoria. This is, for some of us, the beginning of this discussion. For some of us, it's part of an ongoing discussion, but it's absolutely clear that for none of us, this is the end of the discussion. This is challenging us all to be more aware, more understanding, and more active in our roles in support of each other. It's time for a gender and disability equitable world. On that note, I'm going to say thank you for attending, and we hope to see you all again soon.